Hello everyone and welcome to this video of Trust TV. I'm your host Memo here, and with us we have again Dr. John Willardsen. Thank you for being here, Doctor.
Yeah, thank you, Memo.
And in today's video we're gonna go over a clickbait news report that came out probably about a year ago at an Arizona news station that talks about millions of complications that have happened with dental implants. So we want to go over the whole video with Dr. Willardsen, who's in this channel. We've talked about all these things, and we want to cover those complications and just the key points that they mention in this news report.
Yeah, and so as the title says, millions of complications with dental implants. Before we go into the video, let's discuss, what are some of the complications that can be seen with dental implants. There are surgical complications, which would be bone loss, implants failing, loss of an implant, and then there's prosthetic complications. So I don't know what they're quantifying or qualifying as a failure. If a patient, for example, gets a removable set of implants and it's not working for them, which is actually the case that they show where the patient has removable prosthetics are not fixed. Most patients that think of dental implants think fixed or permanent, that it doesn't come out. That's a complication, So I think it's kind of a stretch to say millions of complications, but hey, let's watch the video and we'll kind of go through it. Not critique it, but discuss and bring it back down to reality a little bit. So, perfect.
Welcome back. Tonight we have an Arizona's Family Investigates special report exposing the risks of something that's pretty common. We're talking about dental implants.
Investigative reporter Chris Pickle is joining us live in studio. You've put so much work into this, Chris. What can you tell us?
And this is going to surprise a lot of people. We are exposing that dental implants have millions of reports of problems, according to an expert, more than any other medical device.
So again, she says millions of complications, millions of problems, more than any other medical device. So, they're trying to pull the audience in and create like, oh wow, dental implants are horrible. But dental implants have one of the highest success rates more than any other device in the right hands, doing it the proper way. So, I get the news has to create content to bring in an audience, but in reality, they're creating something that's not necessarily true.
And when I shared what we uncovered during this investigation with the FDA, the agency added additional warnings on their website.
What do I say? Save my life.
Let's follow this case, this patient that they've selected as their complication patient, because she is having complications, and a lot of it is caused by the dentist, but also caused by what she chose or what she elected to have done. She has a removable prosthesis. It comes in and out. It's not fixed. It's not permanent. It's not something that we would ever consider doing here at Trust Implants. And we'll pause on where the implants are, the location, distribution, and it's all wrong. Like, I can tell that this case was done just on the fly and not a lot of thought went into it. So as a result, she does have some merit in the sense of that so the news picked the right patient to talk about complications, because she's certainly had plenty of complications. But, here at Trust Implants, or in a well-respected implant center, you would not see these sort of complications.
Save my life. I don't want to be sick anymore.
So frail, she rarely leaves her apartment. Ginger Peters says for 11 years, she's been dying a slow death.
I'm always sick. I'm just always sick.
Were you always sick before the dental implants?
No.
Pictures show how the once active 5'9" blonde dropped to just 85 pounds at her lowest. Ginger says this started when she went to have a cavity fixed, but the dentist convinced her pulling her teeth would help her recover from.
Okay, so I know it's a little bit hard to see here, but in just looking at her x-ray, She's missing a lot of teeth from the view that I can see. She's got teeth that need to be extracted. Was it appropriate for the dentist to pull all of her teeth? Probably not, but it's hard to say, you know. I mean, we're basing this off of an x-ray from a video or from this newsreel. So there's quite a bit of kind of grandiosing the story and making a little more bigger, you know, bigger than it really is. And in reality, she, you know, there is definitely complications, but she could have easily, had she been in the right practice or the right hands, she wouldn't have had to deal with this sort of a thing. And with the number of, because of the all-on-4 procedure, you're now, and they developed it to put it in the hands of more doctors so that more people can have implants. And this is exactly what we're seeing here in our market. You know, patients walking into an implant center, one of these, you know, like a G4 implant center or A4, whatever they call them nowadays. They, you know, most implant centers that are corporate have, you know, a letter and a 4 after it. And so that means they do the all-on-4 procedure. So, you know, they're going to see her and do what they do, and that is extract her teeth, put in 4 implants, and then give her whatever prosthetic that they've decided to give her.
From Valley Fever.
You went in for one cavity and the dentist convinced you to pull 22 teeth.
22 teeth and 1 cavity because it was going to improve my life.
But her new teeth never fit right.
These are the posts.
Yeah, so here she's got a removable prosthesis. Most patients, when they think of dental implants, they think fixed, permanent, doesn't come out. When we have a removable prosthetic, really is just a denture. It's not. The implants kind of hold it in place, but it definitely is not permanent or fixed. So, anyway, so you know, she also made the decision to let them pull out her teeth, knowing, because she even says, you know, I went in there and they recommended pulling all my teeth. At what point does a patient lose their autonomy to say, no, I don't agree with that. I'm not going to let you pull my teeth out. You just let them do whatever. So
yeah. Well, also kind of talking about that, because that's something that sometimes it's necessary to do, right?
Yes, absolutely.
Because you know, a patient could watch this video and say, well, I don't need my teeth to be pulled out, but then when they come see you and you say, well, I recommend you do this, can you explain why those certain scenarios are
right? And that's where it looks like those x-rays that she showed were old, and so they could have been 10 years old from the time that she did this video. You know, most likely she had some periodontal disease, bone loss, decay, who knows what. And so, you know, I mean, it's hard to say exactly why they ended up pulling all the teeth, but we have cases that we've seen come in that they'll bring in a panoramic x-ray or an x-ray from pre-op before, and they truly did extract good teeth. And that does happen with the all-on-4 because that's where the bone is. Where you've got good teeth is where the bone is. And so with these A4 implant centers, they will choose to pull those good teeth because that's where they have bone. It avoids a sinus graft, and it keeps them doing what they know how to do, their system of doing a all-on-4 procedure.
Yeah.
And so, but, you know, in her case, she ended up with a removable denture, which she would be miserable with. Any patient that has it would tell you that it's not really like implants. She should have had something permanent done.
My gums are in a constant state of...
Right here, look at the position of these implants. So we have, you know, the distribution of implant placement. It is so novice. You know, it screams, you know, a general dentist who does not have surgical background or is not skilled in implant surgery, or whoever treatment planned this case, you know, any lay person, they don't have to be a doctor or a dentist to understand and see the distribution of these implants is not ideal. You got these two implants here that are literally right next to each other. It looks like there's some infection right in between the two implants. And then he jumps all the way over here, throws another one in here, and then throws another one in back here. So there's the continuity of the case, the distribution of implants, the fact that it's removable. It's loaded with complications, but she probably was working with a budget that, was, what they could offer her,
Yeah.
and they probably had their trainee dentist do it, and these are the kind of results that you would expect when you end up in one of those type of implant centers.
Yeah.
And it's unfortunate because she's the one that's suffering, but, just so many factors here I see, I'm just scratching my head.
Infection? Let's get to the bottom. I don't think that they...
So look at the bottom. Again, distribution of implants. She's got 3 implants in there, all concentrated here in the front. That's why she could kick that denture out so easily. Everything's concentrated right here. No implants in the back of the jaw on either side. I mean, it truly is, it's kind of, it's the ideal scenario for a clickbait newsreel to present, to talk about their reported millions of implant problems or problems with dental implants. But this is a train wreck of a case. I mean, it's just truly, no thought. The doctor who did this had no business placing implants. And this is why there are millions of reported implant problems. And this is a classic example of that.
Anything correctly there.
This bin of prescription containers, a small portion of the painkillers and antibiotics Ginger's been prescribed for ongoing gum infections, pain, and health issues.
When I eat, how you eat is that.
So she's talking about when she eats, it's moving around. She eats with that as she's moving the dentures around. Again, that is not the real implant procedure that a qualified implant center would ever consider offering. So she ended up in the hands of somebody who is just learning or isn't versed in implant surgery, isn't versed in the prosthodontics, and so she suffers for that. And so my advice to patients is do your homework. Don't end up in a situation like this, because it truly is a nightmare. She probably didn't spend that much money, but enough to where, she's claiming all of these things. And in the end, she really does not have something to justify I wouldn't spend $20 on this case, as a patient, because the results are so bad.
Yeah, it's worse than it was before she went in with her natural teeth. So.
Right.
How you eat?
They just pop right out.
Ginger's case is extreme, but not unique. Reports of problems or adverse events with dental implants may have remained almost impossible to find if it wasn't for this woman, made a discovery while searching an FDA database.
Dental implants are the most reported device to the FDA now in history.
Madrice is a former FDA analyst. She now runs Device Events, a company that specializes in searching MOD, the FDA's database where problems with medical devices are reported. That database shows over the last 3 years, reports of problems with dental implants have surged.
Anybody who had looked at the adverse events or the problem reports with devices over the last 20 to 25 years would have thought that there were almost no problems with dental implants.
Dental implants are used to replace natural teeth. The implant is the base, which is screwed into the jawbone. Another piece connects the implant to the replacement tooth or teeth. Reports of problems with dental implants have flown under the radar, partly because the FDA had 2 systems for reporting problems. The MOD database, where 58,000 reports were publicly available, and a second system called Alternative Summary Reporting, where manufacturers reported more than 2.1 million problems the public couldn't see. The FDA ended the use of the private reporting system in 2018 and released decades of data. Going through the FDA's database now, Madriz says reports of problems with dental implants are skyrocketing. Watch these numbers. In 2018, there were less than 13,000 reports of adverse events.
Okay, so as we go through the years, 2018, the all-on-4 was kind of just coming into the marketplace. It was certainly, and again, they developed the all-on-4 procedure to get it in the hands of more doctors to provide implant services for more patients. It avoids the sinuses, it avoids anatomy that requires very delicate and precise surgical technique and procedures in order to operate around these areas. And most unskilled surgeons or unskilled dentists that aren't versed in these areas, they love the all-on-4 because it avoids these areas. So now as the years goes on, by 2019, 2020, 21, you're seeing all-on-4 ads all over the place, all-on-4 implant centers, the A4 implant centers, the D4 implant centers, the G4 implant centers popping up all over the country. So,
possibly due to more awareness, reports have shot up by more than 100,000 each year. The 357,000 reports in MOD this year covers January through September.
Basically, the device is rejected. So the jawbone recedes, the tissue recedes, and the implant falls out, or the implant is now.
she can't say that because those numbers, the 350,000, quantify the complication. Is it prosthetic complications or is it surgical complications? She doesn't have that information. All she sees is there was a complication, or was it a complication of patient expectations and the patient was unhappy with the fact that they got a removable prosthesis versus fixed. They were thinking fixed when they were thinking getting dental implants. And so she can't really say that these are all implant failures where the screw, the implant fell out, bone graft, or it completely fell out, because they're not quantifying exactly what the problems or complications were. But again, she's coming out, she's now the face of implant complications, so she's going to come out with a vengeance, because she's done a little bit of research and worked for the FDA.
Never accepted at all by the body.
Of the more than 2.9 million adverse events reported for dental implants, Madriz found 88% are implants failing immediately or over time, which results in the implant being removed.
So it's very concerning to me as well. I'm not sure why the FDA hasn't put out any kind of a notification to patients, to physicians.
The FDA told me there are more reports of problems because more people are getting implants.
Dental implants are extremely safe.
Can implants fail?
Oh, absolutely. It's just like any other medical procedure.
Dr. Terry Work has done dental implants for more than a decade. His before and after pictures show why implants are growing in popularity. But no agency or organization tracks how many dental implants are placed every year.
If there's a dentist that said he hasn't had an implant fail, then they either haven't placed them or they're lying. I mean, it happens. It is one of those things. It's an accepted part of providing this service. I can select the manufacturer of the implant.
Dr. Work is also a consultant for the Arizona Board of Dental Examiners, where he investigates complaints about dental implants.
Not every clinician is equal. There are some clinicians that are more careful than others. There's different manufacturers and the same implant in two different people's hands.
This doctor who's presenting here, the doctor in Arizona, in Scottsdale, Arizona, and I search him up, and he's a general dentist, and he is, he does his training through continuing education, it sounds like. Does not have any background or training in implant surgery or prosthodontics. Bona fide, university-based training. So, he's learned on the fly as well. I'm sure his cases are fine. But, the news, they're not vetting the right doctors either. They're not choosing the specialists who have gone to school and are trained in this. They're kind of just, I don't know how they chose this guy, but for him to be the expert when you have bona fide trained oral surgeons, periodontists, prosthodontists in that market that are not having these sort of complications and failures, it's not fair. It's not fair to the public. It's not fair to the dental community that they go and they talk to a specialist regarding this very delicate, important procedure that has very high success rates. When patients receive their final prosthesis, I had a case today. The patient comes out, we put the teeth in, he just is ecstatic. He's elated. Of course, it's not removable. We're placing implants in the proper position. We're using quality implants that are not titanium alloy. We're grafting where we need to graft. We're doing it the right way. We're not just kind of haphazardly doing things. And so, it's pretty easy to do a clickbait news piece on failing dental implants and choosing untrained doctors to discuss these cases and show cases that are real failures. Truly are failures.
So something that he mentioned there that I kind of want to talk about a little bit more was he's saying that the same implant in the hands of two different doctors can have completely different outcomes. And it's something that we're talking about. Like
all the time, right?
A general dentist can go and get the same material that we use here, but since they don't have the training, the expertise, the background that you have, it could fail. And so...
Or it may not. Sometimes it works.
It may not, yeah. But here at Trust Implants, you've been doing this he's been doing it for 10 years with no real background or training, and you've been doing it for about
He took some weekend courses, maybe went to Mexico and did some training down there. I don't know exactly. I just looking at his bio, but yeah, using proper materials and proper surgical technique, the complication and failure rate goes way down.
Yep. And also something that I wanted to talk about was that this news article or this news report came out a year ago, but you, Dr. Willardsen, have been pretty much cleaning up and dealing with complications for 15 years?
Yeah.
What was it? What was the date where this other practice had?
2012, yeah.
2012 was when the Dental Board of California reached out to you.
11 years.
Right? With about, what was it, like 50,000?
65,000 patients.
Complications.
Of record. So, but we redid probably around 8,000 cases.
Right. So you've seen every single one of those complications, and you know what to do to fix those complications and to avoid them before they even get to the point where they need to be fixed. You know exactly what to do because you've had the #1 training and the experience backing you up.
Yeah, and not that I'm the only guy in the country, because I would never ever, because I can't treat everybody, and B, it is such a precise and delicate procedure and requires so much attention to detail. It cannot be put into the hands of a novice and expect an outcome that will be sufficient for, one, the cost of the case, and also for the demands of the patient. And so as a patient, selecting the proper practice is critical. It's absolutely critical. Not to belabor the fact, but yeah, I literally had to redo thousands of cases, and it was right when the All-on-4 came out. The Dr. Tyke, who jumped on the All-on-4 bandwagon way back in 2007, 8, 9, and 10, by the 2013, he lost his license, and all those patients now were turned over to me. So seeing the ramifications of cheap implants, poor prosthetic design, poor implant placement, it's a big deal. And the news piece has some truth to it, but it's not for dental implants in general. It's putting a very delicate, life-transforming technique in the hands of novices, like this doctor here, and, you know, in the end, not utilizing materials that are the very best. The implant itself, if we just discuss the screw or the implant, that's the most important piece of the puzzle. Okay, so if the doctors are buying implants at a very low, cheap rate, they're cheap materials. There are companies out there that will copy the high quality implants that are way more expensive, 5 times the cost of what the cheap ones are. And that's the only ones we use here. I would never consider using you know, one of these cheaper implants. But most of these practices will, one of the large corporate implant centers just switch systems because of the price, because they got a better price. And this is the largest one in the country. You know, how did they, on a whim, switch an implant? When they're doing, you know, it's the largest implant center in the country, a corporate dental implant center, and they choose to switch systems? Why? I mean, why would you switch systems? The only reason why,
too, right?
Well, yeah, well, they weren't using the very best system to begin with, but they've switched again. But as a corporation, the only reason you would switch the system is because of the price. I would never switch. I just wouldn't, because the systems that I use are the best for the patient. Even if, and I could get implants for so much cheaper. My overhead would go way down. But that's not the right thing for the patient. So a lot of these corporate centers, it's all based on economics. It's all based on the cost of, you know, the procedure. How cheap can we do this procedure and, you know, get the patient kind of a one and done type of situation? You know, as cheap as we can do it, make the most money we possibly can, and be done with it. And that's what's led to these sort of, you know, news reports and situations where you find, you know, millions of reported problems with dental implants. So, and another thing. So here, this doctor in his office and in his practice, he is showing us a denture on implants, so removable and a fixed. So he has that because he offers both. He offers the removable and the fixed. So he says, hey, Mrs. Jones, would you like one that comes out, or do you want one that's fixed? The one that's fixed is going to cost you $30,000 an arch. The ones that is removable is about 10 or 15, whatever the cost is. And again, I would never, even if a patient came to me and said, I will pay you whatever amount of money, but I want a removable prosthesis, I wouldn't do it. The complications are way too high. It just does not feel, I'm just not giving them a service that is, you know, what they would deserve.
And you don't want them to come back
Exactly.
6 months
They
later,
don't want to
a year
be
later.
in here every month or 2 months replacing the parts and pieces, the locator attachments, the pieces that hold it on the implant. They don't want to be in here, and I don't want them to have to be in here doing it all the time, you know?
Yeah, right.
Let's say if you have someone that's in poor health, has poor oral hygiene, they may not be a great candidate. And so it doesn't mean you can't place implants on them, but what it means is you have to tell them, listen, these are the possible outcomes.
But training and patient health may not be the only factors.
Let's look at his x-ray. So, you know, he has placed more than 4 implants, but he's placed about an 8mm implant right here over the sinus. Why? Because he's never put bone in the sinus. He doesn't graft the sinus. The implants he's placed over the inferior, or the nerve in the back of the jaw, same thing, about an 8mm length implant. He's got probably 12 millimeters, so he could easily place an 11.5. So my point with that is not criticizing him, but having the surgical skill to get, you know, a millimeter distance between the nerve, you know, knowing what your safety zone is and being able to work around that, and not staying so far away from the nerve that you put in an implant that's way too short to support the load of the back teeth. So, These are just all the little nuances that I'm seeing in this news report that need to be addressed, because it's, they're putting this out there. So let's create some, a little bit of rebuttal and answers to some of the things that they have presented as like the gospel, right?
Right.
So he's showing me an x-ray that, they're being critical. I can be very critical of this x-ray. Just without even knowing anything about this guy, I already know a lot about him just by seeing this x-ray.
How often do you find contamination on these implants?
Far too many implants. 3 out of 10.
Dr. Dirk Dudek runs the Clean Implant Foundation, a lab in Berlin.
Okay, so the Clean Implant Foundation, a lab in wherever it is. These guys promote zirconia implants. That is their big push. And so zirconia implants are not titanium, but not a modality of treatment for every patient. We use zirconia implants here for certain cases, but it's definitely not a modality that is justified for a full arch case, a full zirconia implant. I'm talking, because we talk about zirconia prosthetics, the teeth, they're talking about having implants that are made of zirconia, and that's what the clean implant system is pushing, all zirconia implants.
Berlin, accredited by the German government. A video he provided shows using a clean room, he has tested hundreds of dental implants that are supposed to be sterile. But Dr. Dudek says he has found everything from toxic chemicals used in production to tiny metal fragments on the implants.
For example, metal particles that contain iron, chromium, nickel, even tungsten. Or
iron, chromium, nickel, tungsten. You would only find those elements in a titanium alloy implant. You would not find it in a commercially pure titanium implant. And again, so they're evaluating implants from the cheap implant companies that are making titanium alloy implants. And so they don't have the rigorous sterile techniques that a company like Noble Biocare has. And so I'm almost certain he did not look at a Noble Biocare implant. And I've seen on some of the cheaper implants, the direct implant companies or whatever they're called, I'll open one implant in the exact same diameter, almost same packaging, the color of the implant is different. And so that tells me that there's not continuity in this system, right? Whereas when I open up a Noble Biocare implant, every single time the color of the titanium of the screw is exactly the same, every single time.
Copper and tin.
Mouths are not all that clean. So what does it matter if there is contamination on the implant?
Every foreign body, every impurity leads to a foreign body reaction.
She made a good point. Mouths are not that clean. Mouths aren't clean. And we end up as doctors that are treating these mouths that are not clean and have implant centers with patients who have dirty mouths. And so by the time our patients finish their case, we've helped them change their mindset on maintenance, on supporting and cleaning, maintaining the prosthesis so that they don't end up again. Because it really is frustrating because dental implants are transformative. When the case is done properly, it transforms their life. But there does require more maintenance. But these patients lost their teeth for some reason. It wasn't that the dentists aren't just they weren't maintaining their mouths, and so they lost their teeth. So what is their option? Dentures. Is a denture a better option than possible complications with dental implants? But again, if it's in the right hands, complication rate goes way down.
Because the body tries to get rid of these particles.
With Dr. Dudek describing various metals he claims he's found on the implants, something Ginger said she told her dentist stands out.
You told them you had a metal allergy.
I did. I told them I had a metal allergy.
And they said, don't worry about it?
Don't worry about it. Titanium is different than metal.
Did they tell you it was?
So titanium allergies are very rare, but if it's a titanium alloy, there's metals in there that a person could be allergic to. I would be surprised if she actually had a metal allergy to the metals in the titanium. I mean, she could, but it would be surprising. And looking at her inside from these videos that we've seen, the reviews we've seen, and her x-rays, the complications are with how the case was done, not necessarily that she was allergic to metal.
Did they tell you it was pure titanium and nothing else in it?
There is absolutely no way you can be allergic to those. Those are titanium.
People can be allergic to titanium, but it is rare. This led us to research what else is in dental implants. Turns out, manufacturers only have to list general materials, such as titanium alloy, which means
So right there, manufacturers, but the quality manufacturers like Noble Biocare, it is only grade 4 commercially pure titanium. And there's no alloy, there's no other metals, and that's why we use it. Again, I spend more to ensure the patient's success. If anybody's using a titanium alloy implant from the knockoff implant companies, they can't tell you how much nickel, how much chromium is in that implant.
a mixture of metals, but the other metals are not revealed.
Okay.
This raises the question, could Ginger be allergic to her implants? I arranged for Ginger to take a highly sensitive blood test to determine if she has a metal allergy. Her results? Not allergic to titanium, but she is allergic to nickel. Studies and medical literature discuss the presence of nickel in some dental implants. This picture shows what can happen if nickel touches the skin of someone who is allergic.
Very, very rarely do we actually see allergies to metal when they are implanted inside the mouth.
Dr. James Yanis is a dermatologist with Mayo Clinic. He says while he has seen reactions to mercury and gold inside someone's mouth, he's never linked problems with dental implants to nickel, and cautions other factors can create symptoms similar to an allergic reaction.
If it's not an allergy, what else could it be?
Gum inflammation alone does not define allergy. It's important to rule out any active evidence of infection, but we need to be mindful of whether or not there are any other autoimmune processes that could be contributing to the redness.
I mean, this is the smartest thing we've seen in this whole segment. You know, it's the inflammation of the gum tissue around the implant because the patient possibly is not maintaining it, or there's plaque or debris or whatever, or because it's a removable device and it's coming on and off the implant, putting pressure on the gum around the tissue, that can stimulate an inflammatory response. So this is the smartest thing we've heard from this whole segment.
The makers of Ginger's implant would not answer our questions, including the specific question on if their implants contain nickel. In fact,
I'm dying to know what system they use. I can almost guarantee it was either Implant Direct, Blue Sky Bio, one of these knockoff brands that is a commercial or a titanium alloy.
none of the more than 24 dental implant manufacturers we contacted would answer any of our questions for this investigation.
Always covering my face when I laughed. So.
While ads touting the benefits of dental implants are easy to find, finding information on the risks is more challenging. On the FDA's website, warnings fell under this generic page titled Implants and Prosthetics, which never mentions dental implants. However, shortly after I took the details of what we uncovered in this investigation to the FDA, the agency added this new page titled Dental Implants: What You Should Know, which lists multiple risks, including failure. But according to the page, the devices do not cause an allergic reaction. In a stack of her medical records, we found the waiver Ginger signed acknowledging there could be complications, but Ginger says the risks were downplayed.
Everything you do, you sign that you agree something could go wrong, but you're not expecting it to. I didn't expect 11 years of my life to be taken from me.
With the average cost of a single dental implant about $4,000 and rarely covered by insurance, Ginger was charged $32,000 for her teeth, but says the real cost.
So she paid $32,000 for, I think she had 4 implants on top, 3 on the bottom, and some horribly made dentures. So, I mean, that's on her, you know. I mean, on her to not choose the right place, not do her homework and due diligence. And so, I mean, she, you know, unfortunately got the short end of that stick.
Well, that's what we see with tons of patients, right? They don't want to pay what it's worth. They want to pay the least amount that they can. They think that they can bargain with the doctor, or they come here and they say, "Oh, that's too much. I'm going to go somewhere else." Well,
and a lot of times they do. You know, they'll end up somewhere else, and you know, end up in a different country, or end up somewhere else. That, you know, they'll take our treatment plan and go somewhere else and get it done. But a lot of times they're back here and we're having to fix it. So now we're back to square one again. You know.
Yeah.
Real cost was her health.
Every morning I wake up, I got to figure out how I'm going to get through the day. And there's been times I don't want to figure that out anymore. I'm tired. I'm sick. And there's nobody out there who's going to fix me.
While the FDA put up this new webpage, nothing has been done yet to alert the public that there are millions of reports of problems. And the FDA acknowledges that not all problems get reported to their database. So while we know of almost 3 million reports, in reality, that number might be even higher. And we do have much more for you right now on this investigation on our website, azfamily.com. I'm Chris Pickle for Arizona's Family.
So, Dr. Willardsen, what were your takeaways from the whole entire video?
Well, a lot. You know, again, I think it was more of kind of a shock and awe, or a shock kind of a clickbait type of a show. The complication rate here in our practice is nothing even remotely close to that. You know, selecting the proper doctor who has bona fide training. It's an investment, no matter how you slice it, it's an investment. So whether you spend $32,000 like in her case, or whether you spend $60,000 or whatever the number is, make sure that the doctor you choose has bona fide university training. They're using the highest quality materials, highest quality of prosthetics. You know, that they don't do removable prosthetics. I would even ask that question. You know, it's there's some pieces here that are true, but a lot of it is not true. And you know, it's something that needs to be brought up, because on YouTube there's so many new implant centers that are popping up that are promoting and pushing all-on-4. It's, you know, the all-on-4s, it is a procedure, but there are corporations that are literally basing their entire practice on that procedure. So you could walk into an all-on-4, one of these, you know, A4 or D4 or Z4 implant centers, and they will recommend pulling all of your teeth. And so make sure that you don't do that. They don't want to work around the sinus. They don't want to work around the nerve. You know, so just do your homework. I'm not saying we're the only place, but I do feel we are one of the best in the country that provides a very high level of service. And we, you know, patients that end up here, they're like family. You know, they end up, you know, we give everything to them that we can possibly give to restore their smile to what they are expecting. So we just don't see that level of complications here at Trust Implants.
Yeah, and I think one thing that we talked about in one of the previous videos that we've shot was that just look at and get not only the doctor's background of where they trained, but also their like successes, like if they've really redone a whole mouth, you know, if they've had
that's true,
no failures or anything like that. And that is the reason why we come up with these videos, why we make these, why we cover these news articles that are saying that dental implants have all these complications or they're not reliable. It's because we want to educate patients. We want to say, do your research, right? Because you've seen these complications for 15 years. So you've been educating patients for so long. For them to do their research to say, okay, even though I want to spend the least amount of money, I also want the best results. And so they have to find the middle ground. For the right treatment, because this is, like you said, it's an investment, and just like any investment, if you do it right, it's going to pay off later, and it's going to last even longer.
Absolutely. And so do choose wisely who you go to, and it is worth every penny. Patients that are losing their teeth or missing teeth or are have lost their teeth. If they were to come here and we were to do their procedure and put a fixed zirconia prosthetic in their mouth, it's life-changing and it's worth every penny. But there are complications out there, and the more dental implant awareness is out there, you're going to have more patients getting them. You're going to have more doctors providing the procedure, and most of the time these doctors are not trained. There's really not even within the ADA, a bona fide implant training specialty. And so even within the specialists, you have guys that have done a lot of implants, you've got guys that have not done a lot of implants. So it's hard as a patient to know where to go and what to do when you're in that situation. So, but certainly a good thing to review and to talk about, because it helps us educate patients. And again, you're right. I have been saying this exact thing for 15 years. And so, you could go back to YouTube videos of mine, that are 12 years old, and I'm saying this same exact thing. So
educating patients now. And that's what we continue to do here with Trust TV. And Dr. Willardsen, thank you again for reviewing this whole video. I know there's quite a bit of people out there who appreciate that and who wanted to hear your insights of this video. And again, thanks for watching this episode of Trust TV. If you have any questions or any comments, feel free to leave them in the section below. Don't forget to subscribe to our channel and hit a like button. Thanks for watching Trust TV.
Thank you.